Welcome to the Advanced Scanning webinar. Today I'll be introducing you to the setup, management, and usage of the Advanced Scanning module, which has the potential of saving you time by automatically analyzing each submitted scan record and subsequently assigning a patient, provider, and subject based on the information extracted from the document. In order to begin using the Advanced Scanning module, you'll need to first ensure that you have upgraded to Evolution version 1.23 or later, and that you have pre-purchased scan credits by filling out the relevant form from the Medtech Global website. Once you have confirmed that you are using Evolution version 1.23 or later, and that you have pre-purchased a sufficient number of scan credits, you are now ready to set up the system. To begin, you will need to add the new Advanced Scanning module to a suitable role. This can be done by navigating to File, Options, Access Privileges, Role, and selecting a suitable role to add the Advanced Scanning module to. In this case, I've selected Receptionist. Under the Not Selected section, under Home, Inbox, you'll see the Advanced Scanning entry. Select the Advanced Scanning entry and then press the Add button. Under Home, selected Inbox. You'll then see the Advanced Scanning entry, as well as the Scanning entry. Both of these scanning modules cannot exist in the same role, so what we need to do is remove the Scanning module. If you do not remove it and you press OK, you'll be presented with an error advising you to remove the Scanning or Advanced Scanning role. In this case, we're removing the Scanning module. Press OK to save. A message will then be presented which asks you to exit out of Evolution in order for these changes to take effect. Press OK and exit out of Evolution, and then log back in. Once you log back in, you'll notice that the Scanning module has been replaced by the Advanced Scanning module. We'll now review the interface of the Advanced Scanning module. Press the Advanced Scanning module. For the most part, the Advanced Scanning module is the same as the original Scanning module. You will, however, notice that there are elements that are different. From the contextual menu, under Advanced Scan Options, you'll now see an entry called Auto Match Selection and an entry called Scan Management. The Auto Match Selection enables you to submit selected scans to have an auto match performed, and the Scan Management button is intended to provide a view of the current scan credit availability and additional auto match options. For now though, the Scan Management dashboard is unavailable, and when you click this option, you'll be presented with a message advising that the Scan Management dashboard will be available in a future release. Under the filter group, you'll also notice that there's a new status quick filter. This allows you to filter out the statuses which are applied after an Advanced Scanning auto match is performed. From the scan grid, there are now several tabs that provide specialized views to support the processing and review of the scan record submitted. The views can be accessed by clicking the corresponding tab. The first tab is Scan Queue. This allows you to manage scans as you would in the current Scanning module. Fundamentally, it is the same as the existing Scanning module grid, with the exception of the new status and details columns, which you can see here. These display additional information regarding scans which have been submitted for processing. From this grid, scan records with a partial match, no match, and failed status, and those without a status will be displayed here. From the In Progress tab, which is empty right now, provides a view of all scan records which are about to be processed or are currently being processed by the Advanced Scanning server. Like the Scan Queue, the new status and details columns will be displayed. The contextual menu, on the other hand, will not have the delete button, the new auto match selection button, and the new quick status filter drop-down available, as you can see here. This is because these functions either can't be used or have no benefit while the scans are being processed by the advanced scanning server. From the grid, scan records with a to be processed or in progress status will be displayed from here. The complete match tab, which we have some records available, provides a view of all scan records which have had both a patient and provider successfully matched. The grid also includes a new patient column that allows you to see which patient was matched to a given scan record, and a new details column that displays additional information regarding scans which have resulted in a complete match, which you can see here. Like the In Progress tab, the contextual menu will not have the delete button, the new auto match selection button, and the new quick status filter drop-down available, as these functions either can't be used or have no benefit once the scans have had a provider and patient successfully assigned by the advanced scanning server. I'll now go through the steps to submit, review the processing scans, and finally review and manage the process scans. From the Scan Queue tab, tick the scans that you're wanting to submit. You'll notice that the auto match selection changed from disabled, a grayed out view, to an enabled view. I'll demonstrate that again. And now when I select all, you'll see that it becomes active. Once you've selected the scans that you want to submit, click the auto match selection button. At this point, a service check to confirm that the advanced scanning server is available and a credit check to confirm that the practice has a sufficient number of credits to perform the scan will be performed. And if successful, then the confirmation message you see here will be presented. This essentially asks if you wish to proceed to perform an auto match of the patient and provider for the selected scans. Once you press yes, an additional message will be presented, advising the number of scans that you've submitted and that the submitted scans have been successfully sent to have an auto match performed. Once you press OK, you'll notice that the scans have been moved from the scan queue to the In Progress tab. Please note that if this practice's scan credit is less than 100, but there is enough credit to process the scan submitted for auto matching, then you'll be presented with a warning message prior to the success message indicating how many scan credits remain. From the In Progress tab, you'll be able to view the scans which are being processed. You will also be able to preview the scan using the Auto Preview button, located from the contextual menu. But you will not be able to open the scan while the scan is being processed. If you do attempt to open the scan, you'll be presented with a message advising that you cannot open the scan record until the match process has completed. You will also notice that there is a bracketed timer that indicates the time since the scan was submitted. The bracketed time updates when you switch between tabs or press the refresh button. As you can see, the time of a subset of those scans has increased and another subset have already been matched. If the timer exceeds 10 minutes, then the scan will time out and will be moved back to the scan queue, either to be resubmitted for processing or manually updated. As the match process completes, the records will be assigned a status based on the outcome of the match process. The possible statuses that you can expect are: complete match. These scan records have successfully had a patient, provider, and subject assigned and have subsequently been moved to the complete match tab. Partial match. These scan records have successfully had a provider and subject assigned, but not a patient as a result of these records having subsequently moved back to the scan queue tab for further review action by a staff member. No match. These scan records may have had a subject assigned, but no patient or provider could be matched due to not being available in the database, or the quality of the extracted data was not sufficient, or there was no recognition template available for the submitted document. As a result, these records have been subsequently moved back to the scan queue tab for further review action by a staff member. Finally, we have a failed status. These scan records could not be analyzed due to an issue that occurred. As a result, these records have been subsequently moved back to the Scan Queue tab and can be resubmitted, or further review action by a staff member can be taken. The scans will now have been processed completely from the In Progress tab. By clicking the refresh button, you can see them disappear, and they would have gone to either the Scan Queue or the Complete Match tab, depending on what the status outcome was. We'll now move to the Complete Match tab, where we can review the successfully matched scan records. You may have noticed that the details for some of the scan records show a date time followed by the bracketed words patient's provider is inactive in red. The reason that this has been highlighted is because the matched patients in these records have an inactive or missing provider from their patient register. Therefore, the system is unable to assign the record to that provider. As a result, the system assigns the default service provider set up from the location that the patient is associated with from the patient register. We recommend that you navigate to the patient register of the patient associated with these records and assign an active provider. If there are a lot of patients with an inactive provider due to the provider no longer working at the practice, you can use the bulk provider update utility located from Tools, Patient, Bulk Provider Update utility, which you can see here. From the Bulk Provider Update utility, you'll be able to select the old inactive provider and then transfer them to the new active provider. Finally, the scan records will be available from the Complete Match tab up until the scan record gets filed. So any scan record that exists in this view will be those that are have not yet been filed. Finally, from the scan queue, all the no match, partial match, or failed results will be displayed. The resulting error of the failed records can be reviewed from the corresponding details section of the failed records by hovering over the details section. In this case, the failed was due to a timeout, so there is no additional details. But in the event that it was an issue with the advanced scanning server, i.e. while it was attempting to process it, the system failed at some point, then there will be an error below under the results section. The scan records which have a no match or partial match status cannot be resubmitted, as the outcome of the processing will be the same. Therefore, these records must have the details manually assigned. If I attempt to select and reprocess no match or partial match, an error will be presented, as you can see here. And the error message advises one or more of the scan records that you have selected for processing have a no match or partial match status. Please remove them from your selection before attempting to perform a provider and patient auto match. A few additional items to note is the details section has multiple lines which can be viewed by hovering over the details section corresponding to a given scan, which I mentioned previously for the failed scan. So as you can see here, you can see the date, time, staff, station, location, and the result. So it gives a bit more detail to what occurred when the auto match processed the given scan. In addition to this, only scan records that are within the look-back range that is configured from File, Options, Location Settings, Clinical tab, which I'll show you. Under the Provider Inbox Lookback range, only the records that are within the 2 weeks or whatever's set from this drop-down will be displayed. In the event you're wanting to view older records, you can press the filter button and change the date time scanned. This will allow you to see historical scan records which may have not yet been processed yet. For further information regarding the Advanced Scanning module, I encourage you to read through the associated release notes available from the Insight Customer Portal, as this will provide you with a more in-depth view on the patient, provider, and subject assigning logic, as well as the steps which are performed in the background that lead to a successful match to occur. That concludes the Advanced Scanning webinar. Thank you for attending.